Okay, so I'm going to be talking about the effects of workplace violence and bullying on the nursing profession, the Canadian health system, and also the society and the population as a whole. So, in the nursing profession, workplace violence and bullying actually take a very serious toll on nurses. It affects their mental and their physical. It causes them to have stress, like burnout, even conditions like anxiety and depressions happen. When nurses actually do not feel safe because they are being bullied or violence is happening, their job satisfaction actually drop because they don't want to go to work and get bullied, or they don't want to go to work and get violence, that causes them to leave their work, and that leads to nursing shortage as a very very serious effect. It also affects the ability to provide care to their patients, thereby putting their patients at risk. And on top of that, a toxic environment weakens the teamwork, collaboration, and also communication, which are very, very important skills needed in nursing. When we talk about the Canadian health system, the violence and bullying also take a lot of toll on them, because when nurses are leaving their job, causing the nursing shortage. It causes like taxpayers money to get new nurses, to get new trainers, and that causes a lot of money to spend to fill these gaps that is being left because nurses don't feel safe at work. So the burnout stresses pushes nurses out of their profession, making shortage even more worse. And in a toxic environment, nurses don't feel safe to actually come and talk about issues that is happening, like medical errors, because they are in fear of getting bullied, so they are not really gonna do that. On the society and the population, the effect does not actually stop on the nurse and the healthcare system. It impacts the public too. Guess what? The public is our main goal. Like, our main goal is to provide service for the public. So when nurses are overworked and undervalued because they are being bullied, it weakens the public trust in the healthcare system. They become like fewer nurses, mean like they have to wait longer, and it reduces access to care, especially in communities that are already struggling. In the end, poor work